Welcome to the 5th Annual Parent Network Conference. We are pleased to have you join us for Idaho Youth Empowerment Services, Yes, Family Survey Results 2020. With us today, we have Dr. Nate Williams. He is going to be talking to us about their survey results. But before we get started, I wanted to go through some housekeeping notes. If you have any questions during the session, please use the Q&A feature that is part of Zoom so that we can keep track of your comments and get back to you with answers. Also, we have some polls. Actually, I think a poll that's going to pop up at the beginning just so we kind of know who is attending today. After the session, you are going to see a survey that asks you how you felt. Please take a moment and fill it out. It helps us make our workshop better every year. Also, if you are an Idaho parent, our new Parent Network survey went live this week, and we are getting feedback from around the state for families to help us kind of understand how things are going on in Idaho. So please take that. You can it will either be in a link that is going to be emailed to you tomorrow, or you can check the idahoparentnetwork.org website and take it right now. And in the coming days, we will post this video and the slides you're going to see so that you can take a peek. That will also be on the idahoparentnetwork.org website. And these slides are actually also on the yes.idaho.gov website because these are in fact about youth empowerment services. Okay, and let's see, with that out of the way, Nate, well, go ahead and go for it.
All right. Well, thank you, Laura, for that introduction. As Laura said, my name is Dr. Nate Williams, and I'm an associate professor in the School of Social Work at Boise State University. I was a principal investigator on this study for 2020 doing the Idaho Youth Empowerment Services Family Survey, and so I'm excited to be able to share the results of this work with you. This was a big partnered process. I had colleagues at Boise State working with me, Dr. James Boschman and Guido Guintini. From Boise State works with me. Also partners from the Division of Behavioral Health aided in this work, and we had families involved in this work. So it's a big project, and it's my pleasure to share the results with you today. And I think as we go through, Laura, remind me, do we want to kind of have questions as we go throughout, or?
I will pipe up and I will ask you questions all the time, Nate, because that's
okay. Good. All right, good. So just jump in and okay. I'll slow down and do it. So just roadmap for today. Real quickly, I'm gonna go over the design of the study and the method that we use so folks have a general sense of it. I'm not gonna belabor that a lot because really what I think is of most interest will be the results of the survey. So we're gonna talk about what we learned from the families that we surveyed, and I'll get into that as we go through. So the first question always with the survey is, why are you doing this work? What's the point? And this survey was commissioned by the Division of Behavioral Health within the Idaho Department of Health and Welfare. And there were a couple of goals with it. The first one was really to get a statewide picture at one point in time of families' experiences and outcomes of YES services. So one of the big keys to this survey was trying to provide one more avenue within the system for families to have a voice. That's an important part of the YES system. And so this survey was designed to do that. It's part of the quality monitoring and quality improvement apparatus that the state has set up. There's several different activities going on for that, but this survey is one of those. So really, and I'm going to talk a little bit more about this, but there were two things we were interested in hearing from families about. One was their experiences of care, sort of what is happening in the actual services that are being delivered, how are families experiencing that? And then the second thing was the outcomes of the services from the family's perspective. There's obviously lots of ways to look at outcomes, but one important way is to get families' perspectives on that. So I'll talk a little bit more about those things in a minute. The second goal of the survey was to establish a baseline for really measuring changes in the quality and the effectiveness of services over time. So as I mentioned, as a state, Idaho wants to be able to see how are things going, identify areas that are weaker, identify areas that are stronger, and really improve in those areas that are weaker. And so the goal of this survey is that we can do it each year, hopefully, and continue to track how we're doing in terms of our progress and improve areas that need attention. And then the third, as I mentioned, there was just to identify targets for service improvement efforts today, right now. And there have actually been some findings that have come out of this and are already being discussed by various groups at the state in terms of thinking about how we might improve services. So the second big question for any survey is, well, what were the topics? What were the questions about? What was the content of the survey? What were you trying to learn about? And as I mentioned, we had sort of these two big umbrellas. One is understanding families' experiences of care, and one is understanding the outcomes of care. Within that umbrella of understanding families' experiences of care, there were a couple of different specific parts of that experience that the department really wanted to focus on and learn about. The first one was, as many of you may know, within the Idaho Yes system, there's a practice manual that says, okay, services that are provided to families within Yes are supposed to follow these specific principles of care. These are things like family-centeredness, strengths-based, youth-focused, and I'll talk about those in a minute, but there's these principles that are supposed to guide all of the interactions that happen between a service provider and a family. And so one of the things that we wanted to do was give families an opportunity to provide feedback on to what extent are the services that they're receiving actually embodying these principles, actually reflecting these principles. So when we talk about family-centeredness, it's about to what extent is the family being respected as the authority and the expert on their own child? To what extent is the family the lead decision maker when it comes to planning services and designing, designing what's going to happen with the youth? When we talk about strengths-based, it's the idea of to what extent are services incorporating the unique strengths and abilities and skills and the assets that each family and youth brings, right? Obviously, services are oftentimes focused on addressing needs, trying to, address challenges that youth and families are facing, but all families have strengths as well. And so really trying to bring those strengths into it. And then when we talk about the principle of youth focused, it's really individualized. So this idea that every youth is unique and distinctive and there's a cookie cutter approach doesn't fit. So to what extent are services really being individualized for each youth? So those were three of the principles that we wanted to assess. And so we designed some questions to try to get at that, the extent to which that was happening for families. The second thing that we wanted to assess was the extent to which services are being delivered in accordance with the Yes Practice model. So the Yes Practice model is outlined in the Jeff D. Settlement Agreement, and it's really a broad document that talks about when services are provided to children and families within Yes, they should be coordinated across providers. It shouldn't be you go talk to one provider and they say one thing and you go talk to someone else and they say something totally different. And it should really be a coordinated effort. It should be collaborative. You should be, measuring the progress on, are we outcome based? Are we getting to where we need to go? There's just some various different standards for quality. And so one of the things that this group did in partnership with families and folks from the Division of Behavioral Health and looking at the literature was identified some quality indicators and said, okay, to what extent are the services families receiving really lining up with these quality indicators that we think are signs of good quality service?
I think a couple terms you use for the families who aren't familiar with them, the Jeff D. Settlement Agreement, that is actually, that is the name of the class action lawsuit that started way back when, 35 plus years ago now. And that was really because children were being commingled in adult populations at State Hospital South, and they weren't being given access to treatment that was really designed for them. And so that's what the Jeff D. lawsuit is, but what has come from that is youth empowerment services. And so when you hear people talk about the Jeff D., you're hearing them talk about the actual legal document that guides what we are creating. However, as Candace can speak to, and she has joined us today, and she is from the Division of Behavioral Health, and she is in quality management, she can tell you as well that Jeff D. is the springboard for what we're creating. However, the state of Idaho has been doing a really good job of actually including parent input into the system that we need. So using that framework to guide our work, we're then creating systems that really work for our families. That said, when we're talking about the principles of care, and the practice model. If you're curious about them, they are on the yes.idaho.gov website. They're all over. You can find them in numerous places, but they really are designed to make sure that the family is at the center of the treatment team and that the family is at the center of what we are doing. So today we are talking about yes things, and some of them include the CANS, the Child and Adolescent Needs and Strengths tool, but it's throughout the system of care. So as you hear those terms thrown around, that's what that is.
Yeah, good. Thank you, Laura. That's really good. Really good context. Really important context. So yeah, so that was kind of the first two pieces of the survey were really designed to have some questions for families trying to get at to what extent is the care that they're experiencing actually consistent with these principles and that family centeredness that we talked about. The third thing that we wanted to check in with families about was the adequacy of safety and crisis planning. So one of the really important goals of any system of care services for youth is to try to keep youth at home and in their community as much as possible. And so we were really, the state was really interested in assessing to what extent are families experiencing safety crisis planning and how is that going from the family perspective. I'll talk a little bit more about that in a minute. The fourth thing that we wanted to check in with families about and assess was how are families experiencing this new Child and Adolescent Needs and Strengths, or CANS assessment? Laura just alluded to this. The CANS, which stands for Child and Adolescent Needs and Strengths, it's an assessment tool that's supposed to help get a picture of what is a specific child's needs and strengths, and then this is a tool that gets used to sort of help identify what services a youth would be eligible for and sort of what level of care they would fit into and really how to best help them. So this is a tool that's been implemented here in Idaho recently within the last year. And so one of the things that the state was really interested in was checking in with families about the implementation of that tool and sort of how's that going from the family perspective. So we have some interesting data to share about that.
And Nate, I think we actually rolled the CANS out January of 18 now.
Oh yeah.
Time flies when we're having fun. Candace, am I right? It's 2018, I think. So
Yeah.
I think that's when it was. It's almost the end of 2020.
Mm-hmm.
Yeah.
We've been doing it for a little while now. Thanks.
Yeah. Thank you, Laura. That's good.
I keep thinking, yeah, it's only been a year. No, it's been longer.
Yeah. So it's been going for a while. And there's been phases to the implementation as I understand it. Like it's kind of rolled out to progressively larger groups of people. So anyway, so we wanted to get some input on that. The other next thing that we asked about were youth and family outcomes from the perspective of families. So these were questions asking caregivers about, thinking about compared to 6 months ago, how much has your child improved, in their behavior at home in the last 6 months? How much have they improved in how they're doing at school? How much have they improved in the community? How much have they improved in their overall mental health? So kind of trying to give caregivers an opportunity to provide some feedback on how much they feel that their youth is benefiting from services. And then the last thing that we asked about, there are a few specific services that the state was interested in asking families about, specifically wraparound and face-to-face crisis visits. And I'm not going to talk a lot about that data today, but it is all available in the report. I should say, I'm kind of giving a high-level overview, trying to keep it succinct for our time that we have today, but there is a full report that's been put together for this, and it is available on the web, and we'll make sure, I'm sure Laura will make sure everybody can get access to that so you can look at the full report.
It is on the yes.idaho.gov website right now, but we'll make sure that there are links to find it easily when we go ahead and put up our resources.
Yeah, sounds good. So as I mentioned, I'm not going to go into a lot of details on how we put together this. So those were the topics that we were trying to assess with the survey. Then once you have your topics for a survey, the next step is to really find your items that you want to ask people. I'm not going to say a whole lot about this other than just to highlight a few key points. The first is that when we went to find items for our actual survey, it really was a partnered process. So the research team was involved. We consulted the literature, what's already in the literature of surveys that have been used with families. We also had partners at the Division of Behavioral Health who were very actively involved, including Candace was involved in this, but sort of programmatic level people, clinicians who were working with families. We had a variety of folks from DBH involved, and also families were an integral part of this process. And there really was this back and forth process of coming up with a pool of items, winnowing those down, refining those, generating new things if we didn't quite have something that fit for our state, and then once we got a set of items that we really felt good about, then going into the work of looking at the wording of those, making sure it's not above a 6th grade level, kind of making sure that it's clear, free of jargon, all that kind of stuff. So there was a lot of steps and a lot of folks involved in sort of refining the items and getting them to where we felt pretty good and like they would be a good start for launching a survey. So the target population for this survey, our dream goal is to really understand the experience of all Idaho youth across the entire state who participated in YES services from July 1st, 2019 to December 20th, 19. So really the back half of 2019. However, as a researcher, my wildest dreams are not always realized. And so when you're actually going to do a survey, you need a sampling frame. You need sort of that list of people that you're going to pull from. And the list that we had available was this database, this statewide database of the CANs, of the Child and Adolescent Needs and Strengths. So in Idaho, the CANs assessments that are complete are within a unified database across the entire state. And so that was what we were able to use for our sampling frame. And that database included 9,373 youth. So that's a lot of kids in Idaho, but obviously that's not all the kids in Idaho that receive mental health services, and it's also not all the kids in Idaho who are eligible to participate in YES and be involved in YES. So that's one of the things to keep in mind.
So families are going to want to know, why did you take a random sample instead of mailing absolutely every family a survey?
Yeah, so and so that's what we did, is we took a random sample. The biggest reason for that is just practicality, right? In terms of processing the data and information, if you get 9,000 responses, I have students at Boise State who help me and input data and do things, but that's a lot if we get 9,000 of them. So the idea with the random sample is to try to get a representative snapshot of folks. And if you do it randomly, then the idea is that you can get a pretty good picture of the population. The other thing that we did is it wasn't a purely random sample, it was actually a stratified random sample. And what that means is that we wanted to make sure, if you just draw a random sample out of those 9,000 kids, you might, who knows what you're going to get in terms of your representation across the whole state. So what we did was we divided the sample up by region and then sampled within every single region. And we did that proportionate to the number of kids that were from that region. So in other words, out of those 9,000 kids, if 15% of them came from region 1, we made sure that 15% of our sample came from region 1. So that way we could get really a picture across the whole state, because one of the things we want to avoid is just getting, a whole bunch of folks in Boise that replied or something like that. We wanted to get a statewide picture.
Right.
So.
Well, I've seen the data and I know how exciting it is. So I'm looking forward to getting there.
Yeah, good. So we'll get there fast. Thank you, Laura. So just so folks know, it was a postal mail survey that we sent to folks. It was a 2-step process. So before they got the survey, they got a letter on Department of Health and Welfare letterhead, sort of official. It was a signed letter. It said, you're going to be getting this survey. This is really important. It's an official thing. It's not spam or some, weird political junk. Like, this is a real thing. And then they got, 1 week later, they got the survey itself. It included a business reply envelope, so they didn't have to pay any postage. They just put their answers on the survey, stick it in the envelope, drop it in the mailbox, and it comes back to them. So that was the survey process. The survey itself was 1 page. So just front and back, 1 page, tried to keep it pretty straightforward. There were 46 questions total, which might sound like a lot of questions, but the questions, almost all of them were like on a Likert response format, where it's like strongly disagree, disagree, neutral, agree, strongly agree kind of thing. So pretty quick to fill out. One of our things that we were really careful about was protecting folks' privacy and confidentiality, and the report details this, and I can talk with folks about this, but it just really, we took steps to make sure that people's information is protected and safe, and so that's the main point of that. All right, so let's get into the results. So first of all, our response rate, that's always the most, the biggest thing is who replied. So we had a total, I mentioned 3,999 surveys is the number we sent out, and we got back from that 352 surveys. So that it comes out to an overall effective response rate after you exclude returned mail of 9.4%. So 9.4% is not great. It's not what I get in my wildest researcher dreams, but it's also not terrible. Sometimes folks assume if you see that, like, that's terrible, there's no way this could represent the population kind of stuff. And that could be true. There's actually been some research on this though, and sometimes you do get a pretty decent snapshot of the population, even with a small response rate. To kind of give you some context, some of the surveys that you see that get reported in the news, like from reputable organizations, from the Pew Center and things like that. I'm not talking about like internet, you know, political surveys, but like credible surveys that do the random digit dialing, they oftentimes only get 1 or 2% response rate. So getting 9.4% response rate isn't great, but it's not terrible. And it is something that we are working on in future years. We have some ideas about how to try and improve that.
So does that mean next year you will send out more surveys to get a higher number of responses? It might be the same percentage, but a higher number?
Yeah, that's one of the things we can do, Laura, exactly, is now we kind of know, like, okay, how many are we going to get back? So that's one thing. The other step that we have is there's some other follow-ups we can do to kind of help with that. So we have some ideas about that, but yeah.
Well,
but one thing is just to send out more.
I do want to mention that, of course, we are limited. The 9,000 number came out of the total number of cans that we had. This year we have around 15,000 cans in the system.
Yeah.
Big change.
Wow, that is a very big change, Candace. So we've gone up in the number of people who we could potentially ask.
Yep.
So, okay.
Yep. Yeah. The other important thing about the response rate is that there were no significant differences in the response rate across the regions. So that's really important. You can see that there were like differences, but they were not statistically significant, which means they're not more than we would expect just by sort of random chance. And so that's important because, you know, if we had gotten like a 90% response rate from Boise and a 10% response rate from everywhere else, then we would feel like, oh, well, really, this just represents Boise then, you know, or something like that. But what's good is that our response rate, there wasn't any statistically significant difference across the region. So we can feel pretty good that we actually did hear from those regions to the extent that they were in there. So the survey was sent to caregivers and they provided the information, but we asked them about the youth that they were reporting on. So on average, the youth that they shared about were 11 years old with that standard deviation of about 3.74 years. So most of the youth were between age 7 and 15. The median, or the sort of middle point of months in services, was 18 months. So half of the kids were in services for less than 18 months. Half of the kids are in services for more than 18 months. You can see the sex breakdown there, 55% male. 88% of the sample indicated the race of the youth was white, which is pretty consistent with Idaho's sort of overall youth population. And then 16% identified the ethnicity of the youth as Latino or Latina. And just for those of you who are doing a math and saying 88 plus 16 is not 100, you are right on. Those are two separate categories on the survey, so that's why they don't add up to 100. So what did we learn? What were the main takeaways? So I mentioned that we ask families to share with us about their experiences of care and specifically about these principles of care, and to what extent did the services they receive really reflect these principles of care. And the three principles we focused on were family-centered, strengths-based, and youth-focused. Obviously, we didn't ask them, to what extent were your services family-centered, right? Like that would be kind of silly. What we did was we developed questions to try to tap into those things. So what you see on this slide are the three principles: family-centered, strengths-based, and youth-focused. And then below those, you see abbreviated items. Now, I've shortened the items down just to try to get the main point and stick them on my slide here. But so these aren't the full items, but the items are available in that report that I mentioned earlier. You can actually see the full survey at the end of that report. So what you see here are the items that were designed to assess these principles. And you can see the first one is, the provider encourages me to share what I know about my child's strengths and needs. That's what that full item is. And families were just asked, that's the statement. Do you strongly disagree, neutral, agree, or strongly agree? Those were the choices. And so what you see on this slide here is, what percentage of folks either agreed or strongly agreed? So gave an affirmative response that said, yes, my experience of care was consistent with that statement. That's what that's kind of getting at. And so you can kind of see how those break out. The other thing you'll see on here is we have that red dashed line at 80%. The idea with that line is that we wanted to have some criteria for saying, okay, when we look across the whole system, what things might be a potential area of strength for the system, what things might be a potential area of weakness. So we came up with this cut line at 80%. It's not an empirically based cut line. It's just sort of based on logic and reason. There's no like statistical criterion there. But the idea behind that is 80% is 4 out of 5 families. So the idea is if you can get 4 out of 5 families or more than 4 out of 5 families saying, yeah, absolutely, that's what my care was like. And if that's something good that you want their care to be like, then that's a potential area where you could say the system is probably doing a pretty good job. So that's what that criterion is there. And you can see one of the items met that, this item about the provider encouraging a family to share what they know. And that's getting at that issue of family centeredness and really trying to treat families as the experts on their kids, right?
I have to say that when we first started having this conversation a couple years ago, I mean, Parent Network has been meeting since 2016. That number wouldn't have been accurate. So the good news is that we are going in the right direction with that. So we're excited to see that.
Yeah, it is a good thing to see. There's room to grow on some of the other ones, but it is a good thing. So now I'm going to show you the next slide. This is the exact same items in the exact same order. So it's all just exactly what you just saw. The only thing I've done is I've changed the graphs on the right-hand side. And so now you're seeing the percentage of families who disagreed or who strongly disagreed with that item. So they said, when we said, as a provider, encourage you to share what you know about your child, they said no, actually. The provider did not encourage me to share what I know. So that's a problem. That's a bad thing, potentially. And again, you see that criterion. We made that 20% criterion for the disagreement. And again, that's based on reasoning and logic. Is not like a statistical criterion. The reasoning here is that 20% is 1 out of 5 families. I'm an instructor. A lot of times I teach classes. I have 25 students in my class. And the way I think about it is, if I have 1 student out of 25 who, gets a D or an F, they don't do well, I kind of know most of my students do good. Maybe that student's had a bad semester. Okay. As the designer of the class, the designer of that classroom system, I'm not necessarily going to like reevaluate everything I did in my class just because 1 student didn't do good 1 semester. But if I get up to 5 students in my class, which would be 20%, if I get 5 out of 25 students in my class who are failing or not doing well, that's a lot of students in 1 class to not be doing good. 5 out of 25 is a big number. And that's, for me as an instructor, that's the point where I say, okay, I need to look at my teaching methods. I need to look at how I'm designing my tests. I need to look at how I'm designing I need to look at myself as a system designer to say, okay, what am I doing here that's not meeting? Because that's a big chunk of folks that I'm not meeting the need for them.
Well,
so that's
if you
kind of
look
the
at
reason.
that youth focus number, that bottom number, my youth is an active participant in
Yep.
planning his or her services. I think that while that number hits, I think it looks like it hits right at your 20% line,
It
give or
did.
take. It's not always because the providers and the team aren't trying to engage the youth.
Yeah.
There are plenty of youth that are like, nope, I'm good.
Yeah.
You figure this out and you let me know. In fact, I think my teen actually once said, what was it? How did he put it? Yes, Mom, when adults meet, you guys are boring.
Yeah. Yeah.
Why would I be here for that? Just you tell me what you decide. And sometimes he'd give me a wish list of things he wanted, and sometimes he wouldn't. But he said, adults just are boring when they talk.
Yeah.
And so that's why he won't engage. So no matter how good that provider is, it wouldn't have mattered to him. So I think that it's important that we don't look at that as simply that the system isn't youth focused, but that there is the participation on the youth side.
Yeah.
And we could do a better job of helping them want to feel and maybe stop being so boring.
Yeah, exactly, Laura. That's really great. And yeah, there's so much in there that's really good that you just said. What I love, one of the things that I liked what you said is sometimes he would give you a wish list, right? Mm-hmm. And so to me, like, that's how you get that youth to be involved in the planning process, right? Not sitting in a boring meeting with people and blah, 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 but somebody it may always sound like it was you, but somebody has a conversation with that kiddo to say, okay, and there's some kind of feedback and involvement in that. So it looks different for different kids, and it's certainly not something that providers can or families can totally control. Nobody can really control it except the kiddo, but it's definitely a multi-piece process, and that's what's so interesting about this data. But that was the one thing that did hit that mark. And so the idea there is, how do we do that? The other thing about active participation of youth is it really looks different to have active participation of a 7-year-old versus a 15-year-old, right? And so that's really a challenge of thinking through, how do we, in an age appropriate way, engage kids, right? Because they can be involved in participating in their services in different ways.
Yes, definitely.
So then the second area that we looked at were some practice model quality indicators. So there's 15 items here. You can see sort of the abbreviated items. These were the things I was mentioning are really focused on, to what extent are the services collaborative? To what extent, is the provider openly and honestly communicating? Is the assessment an accurate representation of the child's needs? When there are challenges, is the provider really working with the family to kind of identify new services or interventions to kind of help get through those? Are services accessible? Are the goals we're working on important? Are services respectful of our family's identity, culture, religion, language, all those different pieces? So these were those quality indicator items. And again, you can see sort of the percentage of folks who agreed or strongly agreed and the percentage who disagreed. 4 of the items really crossed that 80% threshold. And somebody said to me, when they looked at those, they said, well, Nate, those 4 items kind of sound like counseling 101. And I said, yeah, actually, I totally agree with you. Like, that is counseling 101, but I would argue that it's important to assess those kinds of things, because if we're not doing well on those, then we know we have a really serious problem, right? Like, that's a
Well, and there's a difference between a provider thinking they're doing it and a family feeling that way.
Yep.
And so I just did some rough numbers because, I pulled out my calculator while you're talking, and I'm looking at the bottom 2, and we're in the 60% there, the low 60%.
Yep.
And, I think it's important for us, even when we're doing better than 50%, to think about how many families, are in the section that's not the bar, right? So
Right.
almost 40%. So Candace said that we are up in the 15,000 range this year. And if we extrapolate this data just a little bit, I know the family can easily access services my child needs most. That leaves almost 5,700 kids right now that's not what they think is happening.
Yeah.
And the question is it a failure of the family to find them, which I don't know that many families that aren't looking. And is it the providers who aren't providing them? Is it the system that's not supporting them? I think the thing I love the most about your data is that it gives us some really great questions to start asking.
Mm-hmm.
Because when we look at those numbers, I mean, they're over half, but I would really hope that families can easily access services my child needs most, that we're going for more than 4 out of 5, that someday we're looking at the 9.5 out of 10, the 10 out of 10. And but I love looking at these numbers because it gives us a place to go.
Yeah.
It gives us a place on the system. We don't have to wait for it to be at the 20% mark.
Yep.
We can look at it from here, and provider makes specific suggestions for services. You know what? That's a great number. We're almost at 80%, but it may be that providers are doing such a good job of working with families that they're doing it so collaboratively that they don't see it as their provider giving them suggestions.
Yeah.
I mean, so I think there's a lot of interpretation on how people will see this. Some of these numbers are where they are because providers are so good at what they do. Some of them are where they are because families live in communities where they don't have access. And it's not that the provider isn't doing it. It's that, they just live in an area that doesn't exist yet.
Yep.
So anyway, I love these numbers. I'm a number geek. I don't do research, but I love looking at them.
Yeah, no, that's really great, Laura. That's awesome. This is like the most fun that I've had doing and presenting this data, Laura. It's great to have your perspective on that. So I'll show, these are the same items in the same order, but this time looking at the percentage of families who disagreed or strongly disagreed, and obviously there's a pretty close correspondence between those 2 things. 2 of those items went above that 20% threshold that I mentioned, and one of them was one of the ones that you highlighted, Laura, about the family not being able to easily access services that my child needs most. And there's a lot that goes into that, obviously, right? But this is from a family perspective saying, you know what, I'm really not able to get that, what I need. And so the goal, I think one of the system goals is thinking about, as a system, how can we do a better job of making sure that folks have access to those services?
I think one of the things that's kind of hard to quantify, but is important for us to know, is that we have many families who have multiple kids who need mental health services.
Yep.
It's not one kid in the family. So when we talk about easily accessing services, sometimes it's not getting one kid into care, it's getting the whole family into care, because they have so many kids, and coordinating that between them. And finding agencies and providers who can accept an entire influx of a family.
Right.
And
Yeah.
so I think that that is something that, as we move forward, we're just going to have to pay closer attention to. At the parent network, we've received more and more calls lately from, you know, no one can accommodate all of my kids. I can't have a kid at this provider, and this provider because I can't get there.
Right.
And
Exactly.
so I think that that number is going to take a lot more picking apart
Yeah.
to figure
Yeah.
out the whys.
Yeah. It's a really good point, Laura. And that reminds me too, when we did do this survey, one of the things that we did is for families that have multiple kids in care, we randomly selected one and then said, please complete the survey about this specific child. So just to kind of provide that context. But that's a really good point about when you have multiple kids, now it's like the whole coordination. Can the agency, does it even have that capacity? And you can't be running around to different providers. And it's really a good
Now,
point.
and the comments that we have flying in right now are all variations of very rare that one agency wants all the kids,
Yeah.
and there just aren't any providers. And depending on where you live in the state, that is very true.
Yep.
And very true. So.
Yeah. That would actually be an interesting analysis, would be to look at, and I didn't do this, but I just thought of this just now, to look at variation across the regions in the answer to that question. Like, is there evidence that certain regions are reporting more problems accessing services, which you might think would be the case maybe, but.
And I think it's important that all regions aren't created equal. For example, Region 7 has Idaho Falls.
Right.
But if you leave Idaho Falls, how many providers? If you exclude Idaho Falls area, what's access to service outside of that? Just it's something to think about. Not that I want to give your students any more numbers to crunch, but there you go.
No, it's a really good point. Okay, so the next section that we asked families about was the adequacy of safety and crisis planning. And this is actually kind of a neat story about getting some feedback. So we did a little pilot of this survey last year in 2019, and we only surveyed families who had been served specifically by the Division of Behavioral Health. So it was a smaller, more targeted group of families. But I presented the results actually to the Parent Network conference last year, and some of the feedback we got was, well, do families really know what a safety crisis plan is and how that differs from an assessment? So what we did on the survey this year was we actually gave a little definition of like a safety crisis plan is, blah, 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 to plain language definition of what that is. And then we also gave families the option to say, you might not feel like that applies to your child. Like maybe you don't think your kiddo needs a safety crisis plan at this point in their life. So you can mark here if you don't think this applies to your child. But if you do think it applies, then you can answer these questions. So I have it down at the bottom of the slide there. About 39% of the families said, yeah, I don't think that applies to my kiddo. They don't necessarily need a safety crisis plan right now. So the two bar graphs that you see here to these two questions, I put the agree and disagree on the same slide because there's only two questions. But what you see here are only the families who did feel like their child needed a safety or crisis plan. So what you can see is there was two questions. One was about, did the provider help you make a safety crisis plan? And then the second one was getting at, do you actually feel confident that that safety crisis plan is going to be helpful in the time of an actual crisis? And again, these are abbreviated items that I have on here. But you can see that for both of those, both of them crossed that 20% threshold. I think for the making a safety crisis plan, I think it was like 35% or so of families said they hadn't been helped to make one.
So that was one of the very first questions we asked in our very first Parent Network survey. We asked families a couple things. First of all, could you define a crisis for us?
Mm-hmm.
And there was some question as to what is a crisis, right? And I think the conclusion we came to after gathering the stories is that a crisis could very loosely be identified as any situation that is unsafe that the families are unable to handle by themselves. I mean, there were a lot more specifics and there were some very intense stories shared with that question. But when we asked this question, do you have a crisis or safety plan? 2/3 said either no or I'm not sure. Well, if they're not sure, then it's not a very effective plan because they don't know it exists, right? And as we've asked that question over time, the numbers have gotten better, and what you're showing is better. But the fact that we have 39% of respondents that said they don't even need one, crisis and safety planning is actually part of the process after you've got a CANS and you sit down with your provider to plan. So if we have 39% that are kind of like, yeah, I don't think I need one, I'm grateful they don't think they need one. I mean, that means that hopefully their mental health stuff is being managed very well. It's still a problem. And a comment we just had come in, and we have heard it many times: calling 911 is not a mental health safety plan.
Yep,
Calling the
exactly.
police is not a safety plan.
Yep.
And most families don't know the difference between a crisis plan and a safety plan. So crisis plan is how not to have a crisis plan, I think, is what we should call it. And a safety plan is, if we are in a crisis, how do we stay safe at that time? But it's rare to find a family that has a robust safety plan or a crisis plan that they know how to implement, and that doesn't have call 911 as step one. And
Right.
so of all the numbers we see, these are some I am looking forward to the most change as we move forward. I'm hoping that this is what we change. So.
Yeah, that's really good, Laura. Thank you for sharing that. And I can say this is one of the areas I believe that's really been keyed on, is that, okay, we've got to get this right, because it really is foundational, as you said, to everything. So good context there. The next part of the survey the next set of experiences that we asked families about was their experience with the Child and Adolescent Needs and Strengths, the CANS assessment. So we have two groups of questions that we asked about. One set of questions, there were 3 questions about sort of the experience of doing the CANS assessment and what happened after that. And then the second set of questions was about sort of the value, how much value did the CANS add to your child's care? So the first 3 questions you can see here are about, is the CANS accurately reflecting the family's needs? Did the CANS help develop a positive shared goal for the future? That's one of the things it's supposed to do. And after the CANS, did the provider explain what services the youth is eligible for? That was something that when we were working on putting these items together, some of the families emphasized the importance of that. So these were the 3 things that we asked about, and you can see none of them hit that mark of being a strength, and 2 of them hit that mark of being an area of potential weakness and need for growth, in terms of really using the CANS to develop that positive shared goal. And after the CANS is completed, really having a conversation about, okay, what does this mean? You know, where do we go from here, and in terms of services and eligibility and things like that.
I think some of the change that we see coming that impacts these numbers is that the CANS is a little bit of a paradigm shift on how we do things. It's, not just, it's not just the what's wrong with your kid list. And I think very frequently families are used to filling out the sometimes always never list of horrid, right? That's what we've been asked to do. And so now all of a sudden we have a CANS, and they're asking about our strengths and what we do well and how we interact. And it's more of a story as opposed to a checkbox. And it's not a checklist at all. It shouldn't be. And so I think part of it is that for it to reflect your family's needs, you have to be able to share all your story and feel very comfortable. And there is a little bit of vulnerability that comes with doing a CANS and needing to have a relationship with your provider so that you're ready for that. But that also means the provider engaging the family before a CANS so that everyone's ready to do that. And I think also when we're talking about what the services they're eligible for, it's that's tough, because if you live in an area where there aren't that many services, it's not, the CANS didn't open up, a magic box full of things that didn't exist before. It's how we're using them and how we are targeting those services for specific goals and specific needs that have been identified and to support strengths. So I think that a little bit of it is the learning curve, a little bit of it is the access to services, but also a little bit of it is the ability and willingness to be vulnerable. And I have found from our experience that it is easier to do that when I have time to talk to the provider who's doing the CANS without my kiddos with me, because it is very important that my kids know that I am their advocate and that I am there for them to help them. But some of our story is scary and big and messy. And it is so much easier to have those kinds of conversations with the provider when my kid doesn't have to listen to mom recount their worst day again and again. So that's something I would encourage families. If you want to have a conversation without your kiddo there, that's totally okay as part of the CANS. And, as I'm watching more and more comments come in as we're talking, I mean, I'm glad that people are engaging, but it's coming it's coming in. Some parents are saying, absolutely, don't do the whole assessment with your kiddos there. Some parts, it's very important for them to be there and tell their needs, but others not so much. But we're still getting comments about that crisis. I would say that I mean, you were with us in person last year. You remember how we reacted to some of these. I'm surprised you didn't have to, like, hose us down with riot gear, because we were, we were animated. But I think we get the most animated about crisis and safety planning because that's where our biggest need is. But yes.
Yep.
Anyway, but as I'm looking at the comments, I'm like, gosh, it's like virtually we're in the same place we were last year. It's still a big deal. But yeah, I think with the cans, that's one of the things that families need to know. It's okay to wait for that part of the story until your kiddos aren't there. It's okay to ask the provider, when you guys can talk too. I see Candace took herself off mute. Do you have something for us, Candace?
I think that part of the issue is that they're actually, the cans as a way to document the story. People shouldn't actually feel like they're sitting there doing the cans anyway. So it's an interesting aspect. And I love what you guys are saying. And I also trying to figure out how can the provider do more to engage the youth or child in getting information. So there does have to be some differences in how we do this. And I think that that's an interesting challenge to us to figure out. So really appreciate your input.
Yep.
And one thing before we go on, and I think it's important that we notice, we talk about crisis and safety planning, just to step back. It's one of the things that I'm seeing in the comments a bunch is that the ER really isn't prepared for young kids. Most emergency rooms know what to do with teenagers sometimes, but they don't also, the younger kids that we really have a gap in crisis services, even if call 911 is the plan. So that's what families are pointing out as they're talking here. And also that we have some families who are piping up and saying that when they went in for the cans, they were asked to give the assessor a number on a scale of 0 to 4 or 0 to 3, which do you think you are? Just give me a number and go down the list. I've actually had that happen to me, but not in Idaho. And it is okay for all parents hearing my voice. It is okay to say, this is a conversation and not a checklist. I'll be happy to have a conversation with you, but I'm not going to fill out a CANS checklist. That's not what this is. It's okay. You can tell them I said so. And Candace can smack me later.
I don't think Candace will smack you.
I get really, really frustrated when I hear providers say a CAN shouldn't take me longer than 15 minutes beginning to end for the first time I've met a person. I actually did tell a provider if it took them 15 minutes with me that I would take longer than 15 minutes telling them how I felt. And so I think it's an important thing that it's a paradigm shift. It's not a checklist. It's a conversation. What Candace said is very right. If a CANS is done well, you may not even know that you are having a CANS because you're having a conversation.
Yeah.
So.
Yep, it is a paradigm shift. Really good stuff. Really good stuff, Laura. The second set of questions that we asked about the cans were the value of the cans. And this is interesting to think about in the context of everything that we just talked about. But we asked families sort of really bluntly about whether they felt like the cans assessment felt like it was a waste of time, or if it did not add a lot to help. As far as I can tell, the cans did little to help my youth. So these were the only two negatively worded questions on the survey, but just trying to get at that thing of, are families feeling like this process as it's currently implemented now, which as Laura just described, could be really, really different from how it's supposed to be implemented, what it's supposed to be like, and whether families are seeing the value. And there was, as you can see there was quite a few families not feeling like it's going the way that it's supposed to go, which I think this is getting at what Laura was saying is, and what I've heard other people talk about with this data is this really is pointing to an implementation issue, more of like how CANS is just a tool. You can implement all kinds of tools really well or really terribly, right? And so the question is, how is the CANS actually being implemented and how is it being used? Is it feeling like a conversation? Is it being a story? Is there the vulnerability there to actually share good information? All those kinds of things. And if it's not, I think that's where probably you start to see people feeling like it's not as helpful.
I'm not sure parents know that there's an actual output. Like the answers they give are input into a system and it actually generates an output that has information to help identify the areas that need to be worked on, the areas of strength and the area of need. And I don't know how many families are asking for a copy, and I don't know how many planning teams are referring back to what the CANS is saying when they're identifying the next steps for treatment. And to determine when you're updating the CANS, because the CANS isn't a one and done, it's a consistent monitoring tool over time. And so if you are in a treatment, the CANS should show some change, positive or negative, depending on if whether what you're doing is effective or not. And when it's used as monitoring, I think we use see more. But when it's a conversation and then it just kind of goes away and you never see it again, then it's harder to feel like it's having an impact. I know when I have it in my hand and I can refer back to it, I feel like it's doing more than when I don't have a copy of what the output really is. And I think it's also important that when the output comes, that's a conversation you can have too.
Yeah.
I don't think that that represents my family. Maybe we didn't write this down correctly, or maybe I didn't express myself well, or maybe we're not on the same page with what I meant when I said this. And that's part of the conversation, is actually looking at those results, hopefully before they're finalized, and knowing that the CANS can be updated anytime your life changes. You don't have to wait for some spectacular date on the calendar to update information in your CANS.
Yep. Really good stuff, Laura. That's really good stuff. So this is information about implementation on the CANS, and obviously there's work to do as we're rolling this out, but this was some of the data that we shared. The other thing, and this might be a good time to mention this, is that one of the things that we've thought about too with Candace is sort of, are there other questions that we need to be asking, or different questions that we need to be asking? And so that kind of feeds into this. This conversation is making me think a little bit about that as well. So the next part that I'm looking at the time here, it looks like we have about 9 minutes left. The next section I have is about service participation. I'm going to kind of skip over this because I don't think it'll be as interesting, and I want to get to what I have at the end. But as I said, all of the results of everything that the slides that I just had are in the report, and I'm happy to answer questions. If people want to email me questions or whatever, that's fine too. So we're just trying to kind of hit the highlights. So in the last couple of minutes here, I want to just talk about one of the questions I mentioned earlier in the survey, or in the presentation, that we asked families about their experiences of care, which we just kind of looked at several different experiences, the principles, the quality indicators, things like that. And then we also asked families about their outcomes of care. I didn't present the outcome data because it's sort of in a vacuum. It's sort of like, okay, 25% of people felt like their child did not improve. Okay. I mean, it's not as interesting. Maybe it's all of that's available in the report, so it's all there and everybody can take a look at that if they're interested. But one of the things that you can do that I think is a little bit more interesting is, we have this data from this survey about families' experiences of care, what they said they experienced, and we have this information from them in the survey about how much they felt that their child had improved. We also collected information about, had their youth had a psychiatric hospitalization in the last 6 months, or been put in an out-of-home placement in the last 6 months. So one of the interesting things to do when you have those two pieces of information is to correlate them together, right? And say, are there certain experiences of care that families told us about that are more strongly related to positive outcomes than other experiences of care, right? Like maybe certain things from this data, we could see that certain things are really, really strongly related to better outcomes and other things not so much. Now, the scientist in me, as soon as I say that, it's an exciting idea, but we gotta pump the brakes. This isn't a randomized experiment, and we can't make any claims that this caused that or anything like that. We need to kind of keep in mind this is a one-shot survey and all that kind of stuff. So we don't want to go overboard in over-interpreting, but it is an interesting question to look at, I think, and might be informative and an interesting place to have a conversation. So one of the things that we did was we looked at, were there some of these items, these experiences of care, that were more strongly related to outcomes than others? And we came up with, there were 4 items that were the most strongly and statistically significantly related to better outcomes for kids. And I call these 4 items indicators of success, because they're kind of, the most strongly related with success. And I'm going to skip through, there's data there, but I'm going to skip through and just show you the items. These were the 4 items that when we looked at which experiences of care were the most strongly related to reduced risk of psychiatric hospitalization and out-of-home placement in the last 6 months, and better day-to-day functioning at school, at home, in the community as reported by the parents. these were the 4 items that sort of rose to the top as the most strongly related to those things. So you can see they come from a few different areas. The first one is a strengths-based item. The services that my child or youth receives focus on what he or she is good at, not just on problems. So yeah, we're talking about problems, but we're really bringing in those strengths and using those as levers for change. Laura was talking about that with the cans. So the strengths focus there. The second was that item that we saw earlier about the youth being an active participant in planning their services, whatever that looks like at their age and whatever that looks like for them. The third one was about measuring and monitoring the progress towards the goal. So really checking in and having something that we're paying attention to, and we're seeing if that's getting better over time. That's, you know, we know from other evidence that that's a really helpful thing in care for kids. And then the last one, not surprisingly, is about the family's confidence in that safety crisis plan, right? I feel confident that my family's plan will actually be useful in a time of crisis. So again, not surprising to see that that would be one of the items that is really strongly related to a better outcomes for kids.
So one thing that I think that we haven't talked about, I kind of touched on it when I said that some of the things that you need to talk about in a CANS can be intense and messy. I think it's important for us to acknowledge for those parents out there, because from our survey results, about half the people listening have not done a CANS and about half are parents. So there's going to be a little overlap there. But for our advocates and our providers, especially, in addition to our parents that are listening, sometimes having the conversations that are part of the CANS can trigger families. And I'm not talking the kids, sometimes the kids, but definitely the caretakers. There's some questions on there about how well you're able to caretake for this child. And I know the first time I heard the questions, it kind of threw me. So give yourself some space to realize that it might impact you, and make sure that you are willing to go and seek some support for that. I know that I actually had a full conversation. I'm like, wow, I don't like that question. This is why. and we talked about it, because some of the pushback that we have seen from families was that it triggered the adults involved and it felt uncomfortable. So please talk to your provider about that. Don't let that be the reason you don't use this tool, because the CANS is a great way to start a conversation. But the creator of the CANS, Dr. John Lyons, he will say over and over again, the CANS is supposed to start a conversation, and data should start conversations, not end them.
Yep.
And so when you're collecting this information, please be sure that if you are feeling impacted personally, please circle back, if, you know, with your child's provider, say, hey, that really impacted me. If you have your own, talk to them, because that's kind of peeling the layers of the onion that may need to be part of this bigger story. And the other thing is that to make the CANS more successful, make sure that you have signed any release of information that you need to sign, so that the information is shared with the right people who need to use it. So if the right person doesn't have it, it's less effective. And so, but when you're looking at these things, I think it's interesting that crisis planning is on that page. Pretty much everything I brought up with you keeps coming up as the indicators of success. It's like parents use this or something.
Yeah, it's good stuff. So I'm mindful, really good stuff, Laura. This is really good. Doing this presentation with you is like 500% more fun than doing it on my own. So I'm mindful of the time, though. We just have a couple of minutes left. So I don't know, this is kind of a good place to probably pause and wrap it up. But I don't know, Laura, if there were other questions or topics that you wanted to make sure that we addressed from the survey. Or
one thing that came in is that some of the families mentioned that if their kids need to leave the state for services, that the CANS isn't always used quite the same way out of state as it is in Idaho. The CANS is not implemented in every system in every state. Many states use the CANS, but not all of them use it in mental health, and not all providers everywhere are trained. So I personally have used it when my kiddo has left the state for treatment, just by giving them a heads up, letting them read the report, and it gives them a better piece, kind of a better context of our family. But you're right, it isn't always used. So for those families who are like, but my kid's leaving town, leaving town. The other thing I'd like to quickly point out is that many of our kiddos do the CANS with an independent assessor. We've got a great group of independent assessors here in Idaho, but it's also important to recognize that their job is not to do the treatment planning with the family. It is to determine eligibility of having a serious emotional disturbance. And so I want to just make sure that you know, that we understand that if the independent assessor is who your first contact is with the cans, they're not coming back to treatment plan with you because that's not their role.
That's a really important point, Laura. I'm glad you said that. Yeah.
So thanks, Dr. Williams. I've been calling you Nate, but I guess Dr.
That's
Williams and Candace. I'm really grateful that you were here, Candace, to keep us on track. I appreciate all the work you do in quality for YES. It is a great tool for us all to have. So thank you, Candace.
Thank you.
Good.
Have
Thanks.
a wonderful day, everybody, and hopefully we'll get this recording up soon for those who missed it. Talk to you guys later.
All right. Thanks a lot.
Bye-bye.
Bye.